So, good day, ma'am. Continuation to the discussion. So, anterior pituitary gland. So, before I proceed, I'm gonna explain the pituitary gland. So, pituitary gland is located at the base of our brain below our hypothalamus. So, it is part of our endocrine system that controls and functions of several other endocrine. So, like controls metabolism, growth, sexual maturation, production, BP, and many vital functions. So our endocrine gland consists of pituitary, thyroid, parathyroid, thymus, and adrenal gland. So growth hormone, releasing hormone was released by the hypothalamus and stimulate growth hormone synthesis by the anterior pituitary gland. So growth hormones is responsible or governs our height, bone length, and muscle growth. So if there is a increased production of our growth hormone before the closure of the epiphysis of the long bone, so it will results to gigantism. So if increased po siya after the closure of the epiphysis, so it will results to acromegaly. So acromegaly is a abnormal growth of body tissue in some areas of the body, such as in hands, so big hands, big feet, and big head. So kung decrease po siya ang production sa growth hormone, so that would result to dwarfism. So prolactin. Prolactin causes the breast to grow and develop and causes milk productions after a giving birth to a child. So both men and women have a small amount of prolactin. So if there is a abnormal increase of prolactin hormone, so that would results to galactorrhea. So galactorrhea is a milky discharge, milky nipple discharge. So this will trigger when there is an excessive breast stimulation, such as sexual activity, wearing of clothing or prolonged clothing friction, then breast self-examination with nipple. So our nursing consideration is we need to avoid breast stimulation to reduce or stop the nipple discharge. So if there is a nipple discharge, so we need to use a breast pads to absorb those discharge. So next is ACTH, or adrenocorticotropic hormone. So this controls the production of other hormone called the cortisol. So cortisol is made by our adrenal gland. So this is located above in the kidney. So if increase ang atong cortisol sa cortisol is secondary to Cushing. If decrease naman is secondary to Addison. So ang cortisol it will help to regulate there is an essential function of cortisol. So it helps our body to manage stress, convert protein into glucose, then it is a tandem of the hormone insulin to maintain constant blood sugar level. So if the increase siya secondary to Cushing, so Cushing syndrome is there is a presence of facial roundness, weight gain around the midsection of the upper back, then thinning of the legs and arms. So they are got easily bruised, then stretch marks. So in Addison's naman there is a presence of low BP, there is a presence of changes in moods, emotions, and behavior. So our nursing consideration of it is we need to decrease the sodium intake in the diet because sodium will promote fluid retention. So it will result to weight gains and accumulation or build-ups of water in some parts of our body. So increase po ng potassium diet, it's because since the elevation of cortisol's level causes hypokalemia. So next is the TSH. So TSH is a thyroid stimulating hormone. So this controls the production of the thyroid hormone. So the thyroxine and tridothyronine, the T3 and T4. So its role is to regulate the production of hormone by the thyroid gland. So if increase ang atong ACTH production, so secondary to, I rather, ano na di ay, so mo to kung ingon dagan na if increase ang atong ACTH is secondary to Cushing's syndrome. So TSH rather di ay thyroid stimulating hormone. So if increase ang atong TSH production, so secondary to hyperthyroidism. If decrease naman is secondary to hypothyroidism. So next is our posterior pituitary gland. So under posterior pituitary gland, there is a ADH or antidiuretic hormone. This is a chemical produced in the brain that causes the kidney to release water, decreasing the amount of urine produced. So if increase ang atuang ADH, so increase water retention. So mag-cause siya sa increase po ang atong sodium level sa atong body. So water, there is a process of water retention, lead to oliguria, low urine output, then edema, fluid build-ups in some parts of the body, fluid volume excess, and weight gain. So concentrated urine, increase urine-specific gravity. So if decrease ang atong sodium level sa atong blood is there is a water excretion. So polyuria, excessive urination. So that would result to dehydration. So there is a process of fluid volume deficit and weight loss. So diluted urine, decreased urine-specific gravity. So our parathyroid hormone secrete located next to the thyroid gland in the neck. So our parathyroid is release a parathyroid hormone or parathormone. So increase ang atong parathormone is increase pod ang calcium levels sa atong blood. So decrease calcium in the bones kay instead na mag-store ang atong calcium sa atong bones, so ginasekret na niya sa atong bloodstream kay there is a increased production of parathormone. So increase calcium in the bloodstream and decrease in the bone. So that would result to stone formation, decrease bone mass because because our kidney will conserve calcium. So if there's a lot of calcium in the bloodstream, so it will store in the kidney. So that's the reason or factor to the formation of the stone in the kidney and decrease bone mass because our bone needs calcium to get stronger. So instead naman na ma-store siya sa bone, so dito na siya sa bloodstream, so na mag-decrease ang bone mass, so mag-lead sa osteoporosis or weakening of the bone. Then our management is increase water intake because we need to flush those restored calcium in the kidney to avoid kidney stone. So if decrease naman, so there is a presence of hypocalcemia, then calcium, our nursing management or management is calcium supplement. So next is our thyroid gland. So our thyroid gland uses